So we're gonna start an IV. When you do so, you either wash your hands or you prep with alcohol first. And I've got my tray all set up. I've got my gloves, my tourniquet, some gauze in case I need it. I've got my extension set and some normal saline, which we'll go ahead and hook up right now. We're gonna go ahead and push that air out. And flush your extension set so that there's not air in it. And I like to loosen that cap on it so that when I'm ready to start my IV, it's easy to take off. I've got my alcohol pad. I've got my tape to secure my IV down. I like to go ahead and rip off what I think I'm going to use and have it ready to go. I've got my labs because we're going to draw labs off this IV. Your lure adapter in the vacuum container. Go ahead and place that together. Make sure you don't grab the one with the needle on the top. And you can go ahead and make sure that lid is off. And you've got your Tegaderm. So I'm going to go ahead and take a look at my patient's arm and decide where it is that I would like to go. So his veins are wonderful. I don't even need a tourniquet to start an IV on him. However, of course, we're going to use one. So I'm going to put my gloves on. And you're going to place your tourniquet depending on the location of where you're starting your IV. So if you're starting it in the hand, you're going to place it around your forearm. If you're starting it up higher in the forearm, then you're going to place it up around the bicep or above your AC. So go ahead and put that tourniquet on. And you're going to palpate for that vein. You want it to bounce back. If you feel something round but it's not bouncy, then it may be a tendon. Try to avoid that. So you're going to go ahead and alcohol it and then let it dry. Get your needle ready. And you're going to loosen the lid just to make sure that it'll slide off. Okay? And I like to get my IV stuff close. So I want you to go ahead and pull the skin taut so that there's not a lot of excess skin, and you want to stabilize that vein so it's not rolling around. All right, we'll poke here. And go ahead and locate that vein. When you have it, there's going to be a flashback of blood, and you're going to advance your catheter, and then you're going to stabilize the catheter inside as you take your needle out. And then to do labs, you're going to connect to this, and then you're going to draw your labs. You do not want to keep this on for longer than 60 seconds because it can ruin your red blood cells. So go ahead and release that. And what I like to do sometimes is grab my 4x4s and slide them right underneath here so that when I change from drawing my labs to my extension, if there's any bleeding, it's going to prevent it from getting all over the clothes. So I've drawn my labs, and I'm going to go ahead and secure that catheter inside again. Take that off and apply my extension set. Screw it on, and you're going to flush the line. When you're done with that, go ahead and lock it. You're going to place your Tegaderm. If you're going to be sending this patient out of clinic, maybe to a hospital, you will want to use this sticker, date it with your initials as well, and then just go ahead and place it somewhere around it. And then go ahead and use your tape to secure it down, and take my other piece of tape and I wrap this to keep this part secure. And this is locked, so it's not going to drain out, and you're done. All right, so the doctor has ordered 500 mLs of normal saline. So I've grabbed my bag, I've grabbed my line, and I've already applied alcohol and gloves to my hand. So I'm going to go ahead and take off the lid. And I like to go ahead and lock it so I don't make a big mess. Take off the top of that, and you're going to puncture the bag. Okay, so then you're going to go ahead and hang it up. And over a garbage, after you squeeze that once or twice, you're going to unlock your clamp until the whole line is irrigated with the normal saline, and it'll start dripping out. And then I go ahead and lock it again. So now we're going to apply it to the arm. And I've got my alcohol wipe that I'm going to go ahead and clean the hub with. Good practice is at least 10 to 15 seconds. And then I'm going to hold it up so it doesn't reconnect to the skin. I'm going to attach my extension line. And based off of what speed the doctor orders, I'm going to open it up. All right, so our normal saline has done. So I'm going to go ahead and lock the line, and I'm going to remove the IV. So I'm going to take off the tape. And good practice is to work your way into the IV center. Then grab your cotton ball or your gauze. You're going to place over the insertion site, remove the catheter, and apply pressure. You should apply pressure for a couple minutes. And you can place the Coban or a Band-Aid around it. If the patient starts bleeding again, they can reapply pressure and even raise their arm up over their head while applying pressure to get it to stop.